Have you ever noticed this swollen flap of gum tissue around your wisdom teeth? It might make your mouth pretty sore, it could make it harder to chew, and it could even make your breath smell bad. This is most likely something called pericoronitis. And that's basically when this gum tissue around your wisdom tooth or your most back tooth starts to get inflamed and starts to grow over that tooth. So the definition of pericoronitis is inflammation and an infection of the gum tissue that covers a partially erupted tooth. This is typically a wisdom tooth, but it doesn't always have to be a wisdom tooth. For example, sometimes it can happen to 12-year-olds. Now, why 12-year-olds in particular? Well, because they get something called their 12-year molars. Your 12-year molars are your second molars. So you have 3 molars that come in. Your first one is your 6-year molars, which is where your first molars come in. And then your second one are your 12-year molars, because around the age of 12 is where your second molars will erupt. And then your third one is your wisdom teeth. If you're lucky enough to have wisdom teeth, they'll come in between 17 and 21 on average. So a lot of times with 12-year-olds, the same thing can happen. That gum tissue can cover those second molars as it's fully erupting, and it can be pretty painful. Same thing with 6-year-olds as their first molars are coming in. Now, this usually happens with lower teeth, not as much with upper teeth, just because how the anatomy of the teeth and the gums are. Now, why does this happen? Well, we said it's because it's a partially erupted tooth. So as that tooth is coming in, it's still not fully growing past that gum tissue. But almost always this gets inflamed because of food. Food gets stuck under there, like you're eating a popcorn kernel or something else, like a piece of chip or something like that gets dislodged and stuck underneath that gum flap. And that piece of food can stay in there because it's really hard to clean. It's really hard to get your toothbrush underneath that, and that food just stays there. Then a lot of bacteria build up, and then it gets really, really inflamed and it can get infected. The other problem with this is the gum tissue aside, all that bacteria covering that tooth can make it a lot harder for that tooth to get a cavity. I see this happen all the time, where even if that gum tissue doesn't hurt, that tooth is starting to get a cavity and that gum tissue is still covering it, so it's not getting cleaned. And it's really hard to fix that because that cavity is basically hidden underneath the gums. That tooth hasn't even fully erupted yet. So if you notice that this is happening to you with your wisdom tooth, or if you notice this is happening to your kid with their molars or something, this is not something you want to ignore. Some obvious symptoms are if you see it, if you see some gum tissue covering up the gums, or if it starts to get red and starts to look kind of swollen, don't ignore it. Definitely get it checked out by a dentist. Or if you start to have soreness or tiredness when chewing, or you start to get a bad taste in your mouth, or you start to get this unusual bad breath, those are all signs. And some more severe signs that you definitely don't want to ignore are if it starts to hurt, if you start to have pain, and if it starts radiating, like not just staying in that one spot, it starts to feel like it's hurting your whole jaw. It can even spread to your ear area. You might also start to notice some swelling, and the swelling can make it harder for you to open your mouth all the way. This is when it's getting even more serious, and most likely from an infection that's spreading. Some people might even start to get some pus or drainage and even get a fever if it gets really bad. And the reason is if this is neglected for too long, it can spread. This infection can spread to other areas and it can only get worse. So how can you treat this? What can you do? Well, the best thing is going to be first going to the dentist every 6 months and getting everything checked out. But at home, what you can do is clean that area out really well. Not just with the toothbrush or with your floss, but maybe try getting like a syringe or something. Sometimes when you get a tooth extracted, they'll give you this syringe which you can fill with water and flush that area out. Something like that can go underneath that gum tissue and just flush it out, because a lot of times, like I said, it's because of food that's getting stuck in there. So if you just simply clean that food and the bacteria out and flush it out, it can just fix itself. You might be able to even try like a water flosser attachment or something like that. While you're water flossing your other areas, just stick it underneath that gum tissue and making sure you're cleaning that as well, because that's an area that you really can't brush really well. You can try even with an electric toothbrush, but it's going to be really hard to get underneath that gum tissue flap. But don't be afraid to go underneath it if you can, because that's the only way you're going to be able to clean it. You can also try like warm saltwater rinses throughout the day, and if it gets really bad, you can try some over-the-counter medications until you can get in, like an ibuprofen or a Tylenol can help until you can get into the dentist. But if you've tried your over-the-counter stuff, like you tried flushing it out, you tried keeping it clean, and you know for sure that you did everything you could, and it's been going on for a few days, definitely it's time to go to the dentist and get it checked out. And obviously if it starts to get worse, or if you start to see signs of swelling or an infection, don't even hesitate, just go right away. What the dentist will probably do is possibly prescribe an antibiotic, but most likely if it's a wisdom tooth, they're gonna recommend getting that wisdom tooth taken out, because sometimes that wisdom tooth is simply just not going to be able to grow in all the way, either because your jaw is too small and there's no room for it, and that wisdom tooth is partially impacted, or that wisdom tooth is just causing too much inflammation and it's just not worth it to keep it around. Sometimes the dentist themselves can flush the area out and see if that helps, but if that's not helping and it looks like it's just a recurring issue, most likely you're going to have to get that wisdom tooth taken out. Even if you just remove and cut off that gum tissue with a simple surgery, usually that gum tissue will just grow right back. Now, does this mean that you always have to get your wisdom teeth removed? No, because a lot of times your wisdom teeth can fully erupt past your gum tissue and you won't have pericoronitis. As long as you keep that area clean and you brush and floss really well, this shouldn't happen. But it usually happens when there's not enough room for that tooth to fully erupt, or when that tooth is just kind of starting erupting and that tooth is still waiting to get past that last layer of gum tissue. So if you've ever had something like this happen to you, let me know in the comment section below. As always, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. What's the difference between a regular cleaning at the dentist and a deep cleaning? And is one better than the other? So first, let's talk about what a regular cleaning is at the dentist. A cleaning is also called a prophylaxis. The purpose of a cleaning is, like it sounds, to clean your teeth. You're gonna remove any plaque, any tartar in your teeth,